Hello everybody, today we'll talk about diabetic ketoacidosis. We will go through the definition, etiology, signs, symptoms and physical findings. Diabetic ketoacidosis is an acute, life-threatening complication of diabetes mellitus. Is it seen primarily with diabetes mellitus type 1 or diabetes mellitus type 2? The answer, it is seen primarily in individuals with diabetes mellitus type 1, and it can also be seen in individuals with diabetes mellitus type 2. It is associated with insulin deficiency, which can be relative or absolute, volume depletion, and altered mental status. What about the causes of diabetic ketoacidosis? The etiology or the causes of diabetic ketoacidosis when associated with diabetes mellitus type 1 and when associated with diabetes mellitus type 2 and pregnancy, we will talk about each one of them. Causes of diabetic ketoacidosis in diabetes mellitus type 1. Number 1, acute insulin deficiency, which accounts for 25% of the patients. 2, poor compliance with insulin. What might cause this poor compliance of insulin? Omission of insulin injections, lack of education of patients, guardian, psychological stress, particularly in adolescents. Number 3 of the causes of diabetic ketoacidosis is bacterial infection and intercurrent illness like urinary tract infection. Number 4, Klebsiella pneumonia. 5, medical, surgical or emotional stress. 6, brittle diabetes. 7, idiopathic. 8, insulin infusion catheter blockage, and number 9 is mechanical failure of insulin infusion pump. What about the causes of diabetic ketoacidosis in type 2 diabetes mellitus? Those causes include 1, intercurrent illness like myocardial infarction or urinary tract infection. 2, medication like clozapine, corticosteroids. What about diabetic ketoacidosis in pregnant women, which are with pre-existing diabetes or with diabetes diagnosed during pregnancy? Diabetic ketoacidosis in this case might be related to unique physiologic changes during pregnancy. What are the signs that we can see on a patient with diabetic ketoacidosis? Ill appearance, dry skin, labored respiration, dry mucous membranes, decreased skin turgor, characteristic acetone ketotic breath odor, and decreased reflex. What about the symptoms of diabetic ketoacidosis? We can divide these symptoms into initial symptoms and the symptoms that may come after due to the consequence of the diabetic ketoacidosis. As for the initial symptoms, those include anorexia, nausea, vomiting, polyuria, thirst. Furthermore, the symptoms that may come as a consequence of diabetic ketoacidosis are abdominal pain, altered mental function, and frank coma. The physical findings that you can see on a patient with diabetic ketoacidosis can be tachycardia, hypotension, dehydration, tachypnea, cosmal respiration, respiratory distress, abdominal tenderness, lethargy, obtundation, and cerebral edema. Possibly also can come coma. In the next video, we will continue talking about diabetic ketoacidosis. Thank you very much for watching and looking forward to see you in the next video.